The effort and positive attitude of staff is noticed, and it does make a difference.
There was no doom and gloom anywhere. It was Tony this and Tony that, and I like that. I don't like this Mr. Barker, and like me, I don't like Mrs. Barker. I'm Val, he's Tony. And yes, the cheerful attitude, I think, was the best.
I've looked at it from the patient trying to fight through it all and get better, and having these people who come in to look after you, that I know they're getting paid for the job, but some of the attention they give you is you know, the way they deal with you is better than just a 9-to-5 job. Much better. You know, it is a calling, there's no doubt about it.
I remember coming for Farrington in the late afternoon and being admitted, and there was a nurse there, and she actually went out of her way to speak to me and say things. She'd say words, and she'd expect me to sort of say the same words. I mean, it didn't do any good, but I mean, she made the effort, and that I appreciated that, and I just knew that I was going to make it from here. I just had that feeling. They gave me, yes, quite a sense of hope. And Jo, the therapist, she was inspirational. Yes, I can't speak highly enough of her.
Well, the physiotherapist here was absolutely brilliant. She used to come and speak to me, and she'd tell me what to do, and when I did achieve something, she praised me up, which was nice. Oh, I've done that, and you know, I was very impressed.
You got the nice physiotherapists coming in and they're saying, oh, Tony, we'll come back and see you in an hour. Want you to try and walk up to the gym today on the Zimmer or whatever. And you think to yourself, God, I don't know, but I'm going to do it. And so you do it. But they make you do things, and or don't make you, but they encourage you to do things in a forceful sort of way that they're not physiotherapists for nothing. They must go through a lot of training to be able to deal with people who obviously think they're not strong enough to do certain things. And you know, once you get your mindset right with a stroke, you realise you've got to do things.
Some interactions or lack of attention can have a negative effect.
When I realised, you know, I needed more help from the nurses, when I realised I wasn't going to be able to swallow, and at first I was given some negative information that I might never be able to swallow, which is fine, you know, but you don't want to hear it. But it was possible that that was what would happen, that I might never be able to swallow. And
did you want that reality?
No, I didn't. I didn't want that then.
Since I've had my stroke, I don't know if it's part of strokes, but sometimes I've got to keep on spending pennies. And of course I wet the bed. And when she said, do you do this usually? I said, no, I don't. And it made me feel a little bit uncomfortable. That's the only thing.
They've got so much to do. And there are some wonderful people who work at Yeovil. I mean, some people say things, you know, about it, but that stroke ward, there are some people there who are beyond, way beyond the call of duty. And you know, I can only say that the odd nurse lets them down, but most of them are marvellous.
One person in particular annoyed Anthony because she was more interested in her notes than him.
There was a lady, and she would talk to you, and she'd write all the time she was talking to you, write notes down, and the next day she would come to you and she would ask you the same things she'd asked you the day before, and she'd be looking at her notes to make sure she hadn't made mistakes. This one person, I felt she was a complete waste of space, to be honest, and when I saw her walk into them, my heart used to sink.
They didn't have that much time, really. They didn't answer our bells all that quickly. We would press the bell to go, because we wanted to go to the toilet, and we'd be pressing it for sort of some time, it would seem, but they used to get there eventually.
How did you feel when you wanted to go to the toilet and they weren't answering the bell?
Frustrated, yes.
Patients and carers need to be part of the treatment process.
Something niggled me. I knew something was very wrong, so went back to find out. I went to the hospital and said, come on, we've got to solve this problem. Look at this should not be. And they said, well, you're still on these patches, he shouldn't be. And then we took them off and everything just went wonderfully.
But is that not an example of you being proactive as part of the treatment, not just one-sided, it's two-sided?
Yes. And I think that something kept niggling at me, there's something wrong here, but you see, I'm that type of person. I said to Tony, there's some people who think doctors are gods. Perhaps they are. They do these wonderful things, but you can't, if something's wrong, you feel in your gut something's wrong, query it. Tell people, don't accept. If you think something's wrong, ask again and again. Are you sure this is the right thing to do? Don't be afraid to ask. That's what I'm trying to say. Don't be afraid to ask.
And when you did ask that question, you were taken
They were
seriously?
onto it straight away. Yes.
I was trying to get her to talk a bit more because a thing had gone, and I made up some charts with silly things like washing, ironing, cooking or anything like that on there, and then if she couldn't think what she wanted to say, you know, I'd put the list in front of her and she would point to that thing, because she would just point into the air, you know, and you were expected. And we had also an ABC board, a couple of boards like that, which were very good. You know, they weren't generally used, but the people that used them, you could see the improvement, the day-to-day improvement on their speech.
My husband used to say, well, he used to get a list and write down all the relevant things that he thought I might ask for. And so he would point to me and say, is it this, is it that? And then when I did learn to speak, he would, and I hesitated, he would suggest things, and I would say, no, it's not that. Don't put my words in my mouth because you're confusing me.
I couldn't swallow. Obviously I had a saliva problem and I didn't realise my lungs were beginning to fill up, and I had to be pumped out at times with, the nurses had to pump me out. And I used to, right up until almost, I would think probably Christmas time to January, I would almost choke at times. I couldn't get my breath, and Val is so marvellous, she's so calming. She doesn't do panic, and it's wonderful because she would say, now what have you been told? Get yourself straight, breathe in through your nose, out through your mouth, calm down, take it steady. And I would do all these things that she was telling me, and that was me panicking for my breath, and she would make me calm, and within a minute or two I was breathing again, normal.
I said to him, look, we've got in this situation, let's look upon this as a learning curve for you and for me. And we've got to think of all the things we can possibly do to get you better as quickly as possible. And we didn't push anything. Gradually, and I tried to inch him on a little bit more every day. I think the carer has got to be, not to give in to, oh, I can't do this, I can't do that. It's, come on, you can. You know, you've got to help. Not push them too far, but realise just how far they can go if they want to.
In this section, we have seen how poor communication can cause distress. We've also seen how the care we provide can reduce distress. The clip showed the importance of making sure people are informed, giving people time to express their needs, the value of making an effort and giving encouragement, having a positive attitude, and the value of involving patients and families in treatment. All these help to reduce distress and give hope. In this last section, we will see some general examples of good communication in practice. The following scenarios show straightforward ways we can help people navigate the hospital and recovery process.
Welcome to our community hospital.
Thank you.
My name's Tracy. What name can I call you, Mrs. Kemble? What do you like to be called normally?
Marion.
Okay, Marion.
Notice how the nurse asks what the patient wants to be called before crouching down to her level to explain what types of therapy she'll receive and who is likely to see her next.
What's going to happen over the next 2 or 3 days, you're going to be seeing our physios regularly 2 or 3 times a week, and also our occupational therapists.
Okay.
The physios will probably take you down to the gym a couple of days during the week, and also do some exercises with you.
Lovely, thank you.
The occupational therapists, they will be doing your washing and dressing assessments, okay?
Yeah.
And just going through your daily activities, making sure that you're okay with those.
Lovely.
All right?
Yeah.
The next person you'll see in the next 1 or 2 hours will be our GP.
After explaining to the patient what to expect next, the nurse also makes sure she asks if the patient has any concerns, listens carefully, and deals appropriately with them.
Any concerns at all?
Just that my son's getting married in August,
Right.
and I just want to hopefully that I'm up and walking by then.
Well, that's
so
a good thing to
it
aim
is,
for,
yes,
isn't it?
it is, yeah.
And in the meantime, I'll give you one of our stroke brochures.
Lovely, thank you
Okay,
very
for you to
much.
have a look through.
Lovely.
And we'll see you later.
Okay, thank you very much.
Okay then.
Thank you.
In this example, we show the importance of being approachable. Make time to find out what they need. Be reassuring, calm, and don't forget to smile.
Could you find out whether I've got the results back from my blood test, which I had a few weeks ago?
Okay, I can do that. I'll just go and check on the computer now, and I'll
Okay,
be
lovely.
back. All
Yeah,
right?
thank you very much.
Okay.
People need to be informed using language they can understand. Consider impairments. Don't talk too quickly. Repeat information if necessary, and check they've understood what you're saying.
I've got your results. I've checked them on the computer. Your U's and E's are all fine. Your potassium and sodium's fine. Are you okay with that?
Could you explain to me a bit more? I don't really understand.
What it means is your kidneys are working fine. There's no problems there.
Oh, thank
we
you
just
very
need you
much.
to carry on drinking as much as possible.
Okay, lovely. Yeah, thank you very much.
Any more concerns later on, just ring your bell if you think of any other questions. All right?
Okay, yeah, thank you very much for your help.
No problem.
Thank you.
Avoiding incontinence is very important to people's dignity, so keeping to the arrangements you've made is important.
Hello, John. What can I help you with?
The patient, who's unable to speak, is given the opportunity to indicate how soon they need to be taken to the toilet.
10 minutes, because I'm really, really busy. 5 minutes then. Okay, I'll be back in 5.
Importantly, the nurse returns on time. Patients benefit from being involved in decisions made about their care. Make sure you listen carefully, crouching to achieve eye-level contact and giving them time to speak. Summarise what they've said to confirm you've understood them. Avoid being judgmental throughout.
It's about my sleeping tablet. I've been taking it at 6 in here, and when I was home I was taking it 8. I wonder if there's a chance you could alter it till 8 o'clock.
Okay, so what you're saying is before you came into hospital you was taking it at 8 o'clock. Now you're taking it at 6 o'clock.
That's right,
and it's not
I was.
agreeing with you.
No, it's not, no.
Okay. What we can try and do then is get it faxed over, a new prescription for you, so you can take it at 8 o'clock instead of 6.
Lovely.
Are you happy with that?
Yeah, it's fine. Thank you
Okay,
very much
no
for your help.
problem.
Thank you.
When you have new information, return and explain the situation.
Just to let you know, we've got confirmation fax from the GP to say that your tablets can be changed to 8 o'clock now from 6.
Lovely. Thank you very much for changing that for me.
Involving patients in their care helps them to feel in control when so much is out of their control. People appreciate the effort and time you give them. Good communication and understanding can help to reduce their stress. Reflecting on what you've seen today, consider how you could improve your communication for those you care for.